Welcome, everybody. Glad to have you spend a half an hour of your time with us today. Today, we're going to share with you a couple of real-life examples of how customers are using our product. And through that process, you'll discover how our robust and dynamic library of just-in-time training delivers long-term value for our customers. You'll also learn how our solutions can be used to rapidly deploy education and training to make sure we address sudden learning gaps that may pop up. You will hear real life examples of how organizations of all sizes have been utilizing their CMR relationship from emerging biotech and established pharma to enhance their existing capabilities. And we'll also explore how our custom content services accelerate upskilling for our customers, which can quickly close knowledge gaps and drive performance improvement. Laura, would you? Yeah, 92%. 92%. This particular slide we're really proud of. This is the aggregate over a number of years of working with our customers and what they say about CMR. So this 92% is CMR learners that attribute their ability to establish credible customer relationships directly to their CMR coursework. So how do we work together? Well, this is fairly critical. CMR is designed to integrate into your existing program. You do not have to take on a new platform or a new format to work with CMR. We can blend right into your company-specific product content, your current brand messaging, and your internal workflow processes simply by plugging in the CMR Institute ready-to-market library. In addition, we can help you fill learning gaps by utilizing the custom services available from CMR. And then we can clearly work directly with your existing learning management systems, again, creating a seamless relationship. And in addition, CMR's new partnership with Acto brings to our clients the power of our market-ready content through a secure and compliant conversational AI partner. This learning tool that is truly providing the power of knowledge to enhance learners while they're in the field, and that's quite significant and new. So how do we apply some of these capabilities to our customers and actual solutions? Jackie, would you share our first study?
Absolutely, Mark. So I don't think I have to, I'm confident that everyone on this call understands the importance of the new hire program. So what I'm going to speak about is how CMR has worked with clients over the years to implement these programs. So unlike the very specific case studies that are going to follow this one, this program could be considered universal, regardless of your size, scope, or science. This could be one of the most important programs that you launch. So I'm going to cover the what, the how, and the impact that our program has had on our partners. We have successfully worked with a multitude of clients on their new hire programs, and each one, of course, brings a slightly different approach. But today we're going to describe a popular solution and structure comprised of a 3-week progression. Week 1 began with customized resources and essential foundation modules to set the groundwork. We followed that with a virtual workshop where the learners begin to apply the knowledge. In week 2, the module curriculum advances, building on the foundation from week 1. The virtual workshop is designed to reinforce the application. Week 3 culminates with final modules and an in-person workshop, which maximizes the transfer of learning to real-world scenarios. This progressive session not only allowed for the independent learning, but the inclusion of the intermittent workshops brought all of it to life and really made it kind of a real-world experience for the learners. I have to speak about the how. This is incredibly important. The client is supported through every step of this expanding need by our incredible client success team and our expert learning designers. Our current and efficient library is leveraged and combined with custom prepared materials to fit seamlessly into the client's environment and hopefully exceed their expectations. Collaborative calls, regular touch points, and attention to timelines all play a part in how this quality program came to a timely fruition. We really are acting essentially as an extension of your team in this model. All of this is great, but let's talk about the impact. Without the impact, why do we do it? So this solves 3 problems. It provides experts and developed content quickly. So this helps alleviate any pressure on internal development, avoiding lengthy costs, resources getting, sucked up. Our quality and unbiased approach to our development ensures regulatory and legal compliance. Now, I'm pretty sure this is going to translate to some peace of mind to most of our customers, if not all of them. And the consistent quality of the content is the same across all of the new hires. So this program has been proven successful over a number of years, right? So year over year, what CMR is able to do is make sure that that content evolves with you so that it is always timely, always accurate, and always available. The scalable, progressive nature of our content allows us to apply this format to additional scenarios. And at this point, I'm going to kick it back to my friend Laura Galaviz to go into an in-depth case study around the workshop.
Thanks, Jackie. So we mentioned how our client success team and the learning strategies team work to help create custom and customized content. And this particular case study is really going to dive into that, as Jackie mentioned. So one of our customers had a need around an upskilling. So prior to an annual business meeting, they realized that they needed a level set on particular content areas. And 6 weeks was the timeline for us to help them figure out a solution to this need. So with limited time, but plenty of resources, because we have the CMR library, we were able to help meet this client's need in a variety of ways. So the first thing was that we created a small mini pathway of our ready-to-market content from the library to be the pre-work materials. And those materials became the basis for what became the 1-hour workshop. So the workshop was developed and customized to their particular needs around this content area and included interactive materials, facilitator guides, learner guides, learner workbooks, comprehensive resources to really make this workshop come together. And at the end of the 6 weeks, they had the content, everyone was level set, and the impact of this means that by the time they arrived at their annual business meeting, the team was ready to engage. They were ready to go. They were ready to dive deeper and have more advanced conversations and discussions. They were ready to practice, and then they were ready to figure out how to pull all of this information forward as they continue their work out in the field. So one thing I want to highlight here is not just that impact that happened at their annual business meeting, but the long-lasting impact. What happened after the meeting? And after the meeting, because this was a customer of ours who had other content in their library, we saw increased engagement with the other content areas. So what that means is you had learners who were ready to learn more. They were looking for increased knowledge and engagement with the other training materials. They were reinvigorated, and then that momentum will help carry the team forward after the business meeting to help meet the needs that they need to meet in the field based on this topic area. So I think anytime you can have a long-lasting impact based on, one activity, our workshop activities, we continue to see increased engagement with the learning. Oh, excuse me. My mouse got ahead of me. And now Jackie's going to discuss an additional case study that shares a little bit of a different aspect of how we work with our clients.
Thanks, Laura. So this is a very unique situation, unlike the new hire. This challenge was brought to us by a medium-sized medical device organization with a lot of success in the diabetes space. So basically, they were challenged to spin their conversation to a different audience in a slightly different market. So they came to us and asked, how can we, bring this education, branch into these HCP office environments quickly and successfully. So the leg up that they had is that they were already a client of ours. So they were already entrenched in the library, utilizing the diabetes modules and had a good solid footing with our content. So what that allowed CMR to do would basically jump in. We could assess all of the content that they were already using, see what was ready to be deployed and utilized right away, and where the gaps were that we were going to have to be nimble and adjust for to deliver the kind of content that their teams needed. So we took a close look at all of that with our team, our content team, and came up with a custom solution that was promptly delivered and really hit the mark. So the key takeaway here is that this hybrid approach delivered the comprehensive training while maximizing the budget and accelerating the implementation. They actually leaned into and optimized the use of their CMR subscription. So this helped with aggressive timeline goals and very quickly and cost effectively. If they had started to go from the ground up, they would have been looking at, as you know, immense timelines and quite a bit of financial impact. So let's talk about the impact that this had, this program had for this client. They were able to reach 4 specific HCP office environments representing the first-line therapy opportunities. And this directly supported their strategic market growth initiatives. So we were really able to hit the nail on the head. We gave them exactly what they asked for. And because of their partnership with us, they were on their way there already, which was the really nice, true partnership that we got from this case study. It perfectly illustrates how we can leverage existing resources while filling critical gaps to support something very, very specific and strategic on the behalf of our customers. And at this point, you heard Laura and I share real-life partnership stories, including some strategic solutions. And I'm going to toss it back over, and we're going to talk more in depth about our toolbox and solution suite.
So the 2 examples, in addition to the new hire training we shared with you so far, really talk about how CMR's solutions can be custom and customized to fit your unique and particular needs in any area for any topic or around a meeting or whatever the need is, we can create a solution to fill it. And you can see here, if you look at the gears that make up all of the different ways that CMR can assist you, I would like to draw your attention to the complementary curation and really talk about what that means for you. And it's a cornerstone of what CMR does to try to assist you in meeting your topic and training needs. So with our team, we are happy to crosswalk materials. We are happy to take a look at your particular needs, your suggestions, your current training solutions that you have already within your training department, and figure out the right curation of our materials that's going to help you meet your goals. And that's complementary. That's a service that CMR provides, as Jackie mentioned earlier, to become really an extension of your training team. So your goals become our goals. We want to help you, meet your unique challenges, provide tailored solutions, and meet the needs in a variety of ways. And really at the heart of everything that CMR does, even in all the examples we've shared, is the library. And it features over 300 modules, and that's really, it sounds like a lot, but we're always adding and developing more because we want to stay on top of what is at the forefront of our learning and development partners. So what do you need? What should we add? What are the topics that are growing and changing? And we want to utilize this content to help you anticipate changes that are coming. We like to be ahead of what's coming. And we want to help you in this way because it helps you continue your strategic work. So even though our library is large, we're going to tailor it to you. And you can see that it's not just about the size. It's about our comprehensive experience that we have in this area to help our life sciences clients stay on top of their training needs and what's coming down the road. As we know, things change quickly. And so we keep that library up to date to take in hand any market developments, changes, regulatory changes, and our changing best practices. So now I'm going to turn it back to Mark to share a little bit of a wrap up and everything we've talked about today.
Thanks, Laura. I really love that slide on the library. I always, whenever I see it as being connected to CMR, I'm really very proud of the depth and breadth of content. But funnily enough, in a conversation I was having with a client last week, sometimes it might seem like too much information to absorb at one time. And that's why I just wanted to thank you, Laura, for featuring the fact that the client success team that we have at CMR are critical into sorting through what's going to be best for you as a customer. So as we've explored today, I hope that we've been able to help you see and discover how our robust library can be used in different ways for not only just-in-time training, but also working with CMR to predict future challenges that you might be having and address those in short order. I also trust that you've learned how some of our solutions enabled rapid deployment and efficient onboarding while preserving internal resources. You've heard how our organization partners with customers of all sizes to enhance their capabilities by utilizing key components of our solutions. And finally, we've explored how the custom development services can close critical gaps that are unique to your particular environment. In the end, all of this comes together in creating measurable performance improvements through targeted, expert-developed content. So with that, love to move to an opportunity for anybody to submit any questions that they might have.
Mark, there's one in the chat. Can you go back to your offering slide?
The library slide?
I believe so.
That would be
Julia,
Laura.
Julia, is that correct? You want to?
Yep, that's exactly right. Yep,
Yeah,
thank you.
perfect. So
I was looking for it too. Thank you.
Yeah.
great. Julia, so what you're seeing here are, we kind of take our entire library, as Laura mentioned, over 300 pieces of e-learning content, and we bucket them into categories. Those numbers you see associated in the category are the numbers of modules that, through our experience of working with our customers and our particular recommendations for our learning strategies team, that's how many pieces of content can fall into each of those categories.
Thank you. That's so helpful. And disease state, just a quick question on that. I'm sorry, Greg, you've got your hand up. I just saw you, sir. The disease state piece, forgive me because I joined late.
That's okay.
Do you have a listing of the different disease states that you presently have for CMR?
We do. Since we're running this particular presentation through an L10 site, I can't pop open
No, of course.
But the answer to that question is yes. And if you would like, at the very end, we'll have a QR code up. You can take a shot of that QR code and reach out. Somebody from CMR will reach out to you directly, and we'd be happy to show you any of the content in the disease state categories.
Thank you.
Happy to do it. Greg?
Mark, 2 questions and then 1 observation. Sharon, if you don't mind, I'd like to add disease state to my list. I can send you an email to follow up on. If we can go back to that slide, that was really cool. And then Mark, tell me who keeps these and writes them. I mean, I've always thought one of your brand promises was that if we get into that contract with you, you keep them up to speed. But how many writers do you have to keep all this up to date?
Yeah, Greg, that's a great question. It brings up a little bit deeper conversation for some of you who aren't directly familiar with CMR. CMR is a nonprofit in the space. So we are operated and managed by a board of directors. That board of directors is a group of professionals from the healthcare industry, from practicing physicians to executives in the healthcare field. Along with that, when we develop our content, and because of that nonprofit status, we attract a certain type of subject matter expert. Those subject matter experts, we have over 200 in our portfolio of contacts that we can reach out to. Those subject matter experts are actually working in the field that they review our content for. So within that, we have our medical writing team that's comprised of both freelance and full-time colleagues that we will develop the outline, provide it to our subject matter experts for confirmation, do the writing. Then it goes back to a subject matter expert for accuracy before it gets to the client on the first time. All of these modules, though, as we've mentioned several times, are ready to market. So because of that, this is our bread and butter. That process of updating material does not get generated by our customers, but gets generated by the internal research that we're doing, paying attention to changes in the marketplace. Those updates happen seamlessly to our customers, and they are done without a change of scope to the relationship. That's a real significant point, and Greg, I'm really glad you brought it up.
Well, Mark, to you and the whole team, I must say goodbye. I'm double booked here, but I wanted to say this is an unpaid endorsement to whoever's on this call. But everybody says they're customer focused and they're nice to work with. But CMR Institute, you guys are pleasant to work with.
Thank you, Greg.
Agreed. Here, here.
Having said that, I have to go. But thank you for being on this call with us today.
Yeah,
Good to see you, Greg.
likewise.
Bye.
Good to have you. Any additional questions? Well, then from the team at CMR, my close colleagues, Laura Galaviz and Jackie Lancia, we really appreciate you coming today. If you'd like, take a shot of that QR code. It'll connect you directly with CMR, and that will enable you to have a direct relationship and get your specific questions answered. We'd be happy to share with you and show you any of the information that we have to offer in the marketplace, and look forward to connecting with you soon. Thanks very much.
Thanks, guys.
Thank you.
Thanks, Mark.
Thank
And
you.
we will have this recording available. So if you want to brush up, please use the QR code here to reach out to the CMR team, and they could follow up with the materials, which would include this recording. But thanks everyone for your attention today. And it looks like you're getting a couple minutes back to your day.
Thank you, L10.
Thank you.
Have a great day.
Thank you.
Cheers.